Church of Thomas, Healthcare, Sermon 42708. In the recent political campaign, there has been a big discussion of different plans to provide health care to the people of the USA. I have watched these with great interest. I have seen how Europe has implemented the national health care. I have also seen what poor plans can do to stifle an economy. No matter how you feel on this issue, there needs to be some firm plan of action. I was motivated to write on this subject because of a program about health care. In the program, a man named Stan Brock heads an organization named Remote Area Medical. The normal recipients of his organization's aids are in isolated areas of the Amazon jungle. This was a very different venue. The program showed one of his recent missions. It was to Knoxville, Tennessee in the USA. In this inside of the borders of the richest country in the world, with reportedly the best health care in the world, people showed up a day ahead to get a number to wait in line. These sick people slept in their cars. The temperature was quite cold. In the program, the reporter asked what background these people came from. The answer did not surprise me. They were working people who did not qualify for government aid, but did not have the resources to get health insurance. A few had the catastrophic variety of health insurance. It does not cover the follow-up care most would need after the crisis has passed. A woman had cervical cancer removed but had no resources for follow-up care. It was discovered that her cancer was back. If it had been caught earlier, it could have been treated, but she was not. The people far outnumbered the slots that were available. About half of them had to be turned away. As you can see, there is a vast need for coverage. You can also see that they were not freeloaders. I have health insurance that's pretty good. My dental care is a farce. There are many problems with my teeth that I have not had fixed because of the corruption and poor coverage of my dental insurance has prevented. This highlights that even people with great insurance can have gaps in their coverage. When I lived in Hawaii, I observed a different problem. The state of Hawaii had mandated that every employer provide health insurance to their employees. This sounds great. The problem became one of money. The economy of Hawaii is not very good to start with. The unemployment rate ran near 10% when I was there. Many businesses were struggling to stay open at all. These businesses then were forced to provide coverage they could not afford. One of my friends had a construction business. He had 12 employees before this law. He and his son ran it. When he looked at the cost of complying with the law, he was floored. After doing many calculations, he decided to scale back his workforce to no workers. In his calculations, he found that the only way to make any money was to have just he and his son do all of the work. Now, I know a few of you might be saying, well, yeah, he's probably rolling in money. He did not have the money to get health insurance for himself, let alone anyone else. A loophole in the law would allow owners not to have to get the mandated insurance. His workers threw a fit. They told him he could not fire them for those reasons. He told them that he had no choice if he wanted to stay in business at all. He made the hard choice and prays every day that he does not get sick himself. In Europe, I saw very good health care. Preventative care was a major part of it. There is no mandated coverage by employers. The government is the insurer. Many would think this is fantastic. It has some very strong points going for it. Every citizen is covered. If someone lets their heart disease creep up on them, it is their own doing, not for fear of not being able to pay for it. There is a downside. Because the health care is managed by the government, there is a tax on all income to support it. In Denmark, it is a considerable chunk. These are ways that have been implemented to deal with the problem. I have talked with people who have their piece of the pie, and that in that they are covered well by a protection of health care. They have often said, why should we have to pay for some bum's health care coverage? They might even say that that's what all those free clinics are for. On the flip side, I know people that work 2 minimum wage jobs that are not covered. They pray that they never need to be in need of a doctor's care. They live paycheck to paycheck. I will now share my take on the situation. First, if people are not healthy, they do not work well, thus affecting our economy. Second, we already pay vast amounts in emergency room care. It is dragging our health provider system down the tubes. Many wait until they are in dire straits to go at all. Because it has been a standard that all who show up in the ER should be taken care of, it has become the provider of last resort for many people. Some fault the immigrants. That is wrong. The same people who criticize them are often the ones who hire them below standard wage in the first place. They are a significant part of our country and its workforce. By the way, they often do pay taxes, they just get no benefits from these taxes. Because if they are illegal, they are using a false social security number to file their taxes. Now, why should we care? Well, besides it being the charitable and right thing to do, there are great reasons to appeal to our enlightened self-interest. My mom was an RN nurse most of her life. I remember her saying that the training that doctors and nurses get in indigent care is far broader than only people who have coverage. Here at my hospital, there have been serious cutbacks in the money the state allocates to indigent care. There's been a shift to a more payer-customer base. This is a huge mistake. When doctors are only trained on people who get care as soon as they notice something is wrong, there's a big gap in their education. They will never get to see end-stage renal patients. They will never see tumor development across a large spectrum. They will never see exotic parasites or diseases. Indigent care is the only tool to see all of these maladies firsthand at their many levels of progression. A nation that does not provide some way for everyone within its borders, with care is also asking for a serious ass-kicking. It is among the poor, uninsured, and underinsured that our next epidemics are incubated. It is those populations where the threats to the health care of our nation lies. By not treating these people with the same aggressive medicine we are famous for, we leave an enormous gap in our health care safety. To sum this up, we need total coverage, leaving no one out of the system. We need to confront the health insurers with a united front to prevent them from lobbying and making them water down any bills that do get through, or gouging on any proposals that do make it into law. Last, we need to understand that it is for the safety of all of our nation that we need this coverage. Last, we will pay a cost to achieve this goal. To sugarcoat that aspect would be a lie. Analyze any plan put forth by the politicians you hear. May God grant you good health or the help you need, if that is not to be. God bless the whole world, no exceptions. Angel Eliza.